Hi, this is Terry QT with DiepC Foundation, and I'm in San Antonio doing some advocacy work this weekend, and I have the honor and privilege to have Dr. Minas Chrysopoulo and Dr. Ramon Garza from PRMA Plastic Surgery in San Antonio. Welcome, gentlemen.
Thank you.
Thanks.
Yeah.
Great to be here.
So one topic I wanted to talk about, we did a recent poll on the journey, and I wanted to ask you gentlemen both, what is the value, because at PRMA, you guys work as a team. Can you tell us the value of that, both to the patient and to the physician?
Yeah, that's a great question. We do have a two attending surgeon approach to breast reconstruction in our practice. Mm-hmm. And the main value is that patient time in the operating room. It's a more efficient way to do the surgery. Less time in the operating room, it means less anesthesia, less issues with postoperative recovery, mobilization, less issues from the GI tract, getting the patient back on a diet. It's just, from a health perspective, it's a benefit to the patient. From the surgeon perspective, it makes the day more enjoyable working with the same team you work with every day. We're efficient in the operating room, and just leads to better outcomes.
Okay, all right.
Couldn't agree more. Less surgical time is always better. Mm-hmm. So generally speaking, the more you can cut down on your anesthesia time, the lower the risk of overall complications, the easier the recovery, and the shorter the recovery, and the shorter the hospital stay. And so maximizing efficiency in the operating room and basically having a consistent approach to the procedure, especially when they're procedures that you do every day, that's a massive benefit, especially for the patient, primarily for the patient.
Right.
So in our practice, the primary surgeon is the one who sees the patient. So the one who sees the patient in consultation, discusses all the options, makes the best treatment decision, with the patient, mm-hmm. and who actually brings the patient to the operating room. That's the primary surgeon. Okay. And then he gets to dictate how things go. And the secondary surgeon, the co-surgeon, comes in and will help based on what's going on and what the patient needs. So there's always someone who ultimately is in charge, mm-hmm. But everything is very efficient. The co-surgeon will come in and say, "What do you want me to do today?" And so the list isn't very extensive in terms of what we do to get a patient through DIEPflap surgery. There's a whole list of things that need to get done, and we divvy mm-hmm. things up and get the surgery done as quickly as possible in the most efficient way. And we all kind of do things the same way. There's a PRMA way, and so mm-hmm. that makes things more efficient as well, and decreases the risk of surprises. Right? So
I would imagine too, just listening to what you both have said, it probably helps to bounce things off of each other. You go into surgery with a grand plan, right? But I'm sure there's times that things need to change in surgery. And so bouncing ideas off of each other has to just fine tune that process for the patient and for you guys too.
Yeah,
so
for sure. But right. that actually doesn't. We don't. If it's something that requires discussion, mm-hmm. because it's something out of the ordinary. The discussion it happens, before the actual surgery.
Absolutely.
So it's like, hey, that's a the evening before, that's a mm-hmm. phone call. Hey, FYI, tomorrow, here's what's going on. Here's what we're going to need to do. You highlight the importance of communication.
Right.
So
exactly. Yeah. I don't want to lead people to believe that things are being decided there the day of surgery. Yeah. That's a good point. Thanks for clearing that up.
No worries.
Yeah, we don't like surprises. We like a system. We like to apply that system and formula to the patient and maximize the optimal outcome.
Yeah.
So we don't. We do everything in our preoperative workup, our preoperative evaluation, to ensure that we don't have a surprise in the operating room.
Yeah.
And that's something that really comes with just experience in doing these cases day in and day out and having lots of patient encounters. Right. So we know what to look for and when it's going to be something like, hey, this is a little bit different than the typical patient. So
right.
And the primary surgeon picks the music list.
Very important, right?
It's very
yeah.
important. Very important.
We won't get into music.
No, that's not. Enough said.
Hey, thank you both for that excellent information today. I appreciate your time.
Welcome.
All right. Thank you.